Home is a very intimate place, filled with memories, things that we love, familiar routines, and time with friends and family that bring color to our lives. When you provide care in a home, you naturally learn a great deal about your client's life. Knowing details of clients' private lives may make the experience more personal, but it also brings a major responsibility. As a healthcare provider, you are responsible for protecting your client's privacy. Confidentiality or privacy is very important in healthcare. All healthcare providers, including doctors, nurses, home care providers, and companions, are required to keep client information private. To understand the importance of respecting your client's right to privacy, try putting yourself in your client's place. How would you feel if your care provider talked about you, your medical condition or habits, to neighbors, friends, or other clients? Each of us wants to be treated with consideration, and we all deserve the right to choose what information is shared and with whom it is shared. Protecting your client's right to privacy is respectful and professional. It is an essential part of your job as a care provider.
I think in our industry, the hardest concept to get across is that you're dealing with people's private health information in a home setting. And when I'm an employee and I work in a hospital or nursing home, you just get this aura about, I'm in a medical facility and there's procedures and rules, and you're kind of guarded on what you talk about. But in a client's home, it's friendly and warm, and it's so easy just to share, and you can forget that that is private information. So just the natural home environment makes it even more difficult to remember you are a professional and you have private information, and it's your job to keep it private.
Privacy rights are legally enforced through HIPAA, a federal law passed by Congress in 1996. HIPAA stands for Health Insurance Portability and Accountability Act. The part of HIPAA that we are focusing on is the privacy rule, which define how healthcare providers must relate to protected health information, or PHI. Protected health information is any information that can be used to identify an individual in terms of physical or mental health, healthcare services provided, or billing and payment related to healthcare. There are 18 identifiers, and these are the most common. The patient's name. Any geographic subdivision smaller than a state, such as street address, city, county, and zip code. Dates such as birth date, admission date, discharge date, or death date. Telephone numbers and fax numbers. Email or website addresses. Social Security numbers. Medical record number, health plan numbers or account numbers. Certificate or license numbers. Vehicle ID numbers or license numbers. Finger or voice prints. Names of relatives. Patient information can be found in many places, including paper records, computers, printers, copiers, and fax machines.
One of the situations that presents itself very early on for us in a relationship with a client is when we go out for our first home assessment, they may tell us that they want the bill to be mailed to their post office box. And so they're giving us a directive already on how they want us to handle their protected health information. It may just be the name of our company and the service and the amount, but that's part of that whole health information directive that the client has the right to make, and we need to make sure we handle that seriously. Besides making them happy, it is their directive to us, and we want to honor it, and it falls under HIPAA.
HIPAA requires that care providers use only the minimum amount of information needed to give care to their clients. Care providers are given basic information about their clients, such as name, address, phone number, and medical information necessary for them to do their job well. This is considered the minimum amount of information needed. For instance, if a client is diabetic, it would be important for the care provider to know so that he or she can prepare meals that are diabetic appropriate. Follow your agency's policy regarding minimum use of protected health information. Remember, reading client or patient medical records casually or to satisfy curiosity is a breach of HIPAA and can result in reprimand or job loss. Always ask yourself, what is the minimum amount of information I need to know in order to do my job? Minimum use also applies to providing information to someone authorized to receive it. Again, ask yourself, what is the minimum amount of information I need to provide to answer the request? HIPAA supports each person's right to place restrictions on how his or her private health information is used or shared. Before your first client visit, you should know who is authorized to receive private information regarding your client's condition or treatment. If you don't know, or if you are unsure, check with your agency before sharing private health information. Always check with your agency supervisor about sharing health information with any new visitor or family member. Don't assume that because it is a son or daughter that your client wants his or her health information shared. If your client wants information withheld from particular people, report the request to your agency's privacy officer, who will respond. Do not discuss your patients or clients with unauthorized people, such as friends, neighbors, family, or other clients. Never disclose your client's name, location, or lifestyle, or talk about things that occurred during your shift.
We have to spend quite a bit of time with our employees for them to understand this is not their role. They cannot give that information out. So going through these types of scenarios that they're going to deal with helps them understand, so we can kind of role play. When this happens, because we know the neighbor's going to come over and ask, she probably is watching for you to drive up to the driveway.
Hi, I'm Juanita's neighbor. How is she doing? What happened?
How do they redirect? How do you have an answer and not be rude?
You know what? I bet she would love to see you. Why don't you come over and visit?
Okay, I'm coming this Friday.
All right, well, I'll let her know that you came by.
Our employees being very social in nature, they like people, that's why they're drawn to this industry, can sometimes start chatting about the person they've seen before. Oh, I was at so-and-so's house. You might know, maybe they have the same last name. And so those are all parts of human nature that are very hard to break. And so again, it takes a lot of training, talking about all these situations, so to be like, oh my gosh, I would have done that. I would have never thought of that as being a HIPAA violation. One of the other situations that comes about is an employee may have been at a client's home that was just exhausting and frustrating. And now they go to the next client's home, and that client's real friendly and bubbly and likes to talk. And they say, gosh, it looks like you're really tired. And the next thing you know, you're saying, oh, I was at Susie's house this morning, and oh my gosh, she just had me running like crazy, and she can't hardly do anything for herself, and I had to take the cat litter out, and then on and on and on. And now here you just shared all this information about your first client with your second client, and that's a breach of HIPAA. But how easy it was to do, because that client was so nice and just wanted to hear about your day, but you couldn't tell her all those details about your day because that was private. And now you've had a breach of HIPAA, and you may have not even realized it. Another situation is you're at home, and maybe you're doing some charting at home. You can't have that exposed to your spouse and children. that's someone's name? What if that is the name of your child's teacher? You know, now you have a whole new avenue of information that's exposed to a child. They don't even realize what they've seen. So home care presents a whole lot of unplanned, unexpected opportunities for health information to be breached. So the more things we can talk about and expose and think through, the better prepared we are.
Train yourself to keep patient information private.
How's your job going?
I love my job. It can be tough at times.
So are you working with any challenging patients these days?
Well, you know, I can't really talk about my clients. I have to keep client information private.
I understand that.
Yeah. So how are you doing though?
I'm doing good.
That's
I'm doing
good.
really good.
Doctors and clergy members must follow HIPAA guidelines too. For example, if a doctor visits as a friend rather than as your client's physician and asks about your client's health, remind him that you have the same responsibility to protect private health information as he has with his patients.
That's nice. What's his blood pressure like?
Because you are his friend and not his doctor, I have the same responsibility that you have.
When you talk about clients to others who are authorized to receive that information, try to prevent anyone else from overhearing the conversation. Whenever possible, hold conversations about clients in private areas.
Okay. Address? Okay. Sometimes we call the employee and they might be at the grocery store. Because we're not in the building, we're out in the public. You have to be very conscious of, you can't just start answering the question. And the caller might not realize where you are. So it really makes you be much more conscious before you just start responding and answering questions as to where are you? Are you in a private area?
Never give your personal cell phone or home phone number to clients. Clients must communicate directly with the agency about their needs, rather than relying upon you as if you were a personal friend. You may feel very friendly toward your client, but you must remember your role as a professional care provider. You can share private health information about your client or patient when visiting the office of the client's doctor, at the pharmacy when picking up your client's prescriptions, with a supervisor or co-workers involved in that client's care, to 911 or the hospital, with a relative or friend who has authorization to receive private health information about your client. Your client has the right to view his or her own private health information and to copy it. Depending on your agency's policy, the patient or client may need to sign an authorization to release information form. If a client asks to view his or her medical record, contact your supervisor or designated privacy officer who will handle the request. When you're in the office, use good security practices to protect health information. Keep client records closed after use. Never leave any protected health information on desks, conference rooms, or open areas in the office. This includes notes, labels, or forms with patient names. If you see a record in public view where others can see it, take it to the appropriate person or your supervisor. Only people with a need to see information about clients should have access to records. When client records are not in use, they should be stored in locked cabinets or a locked room. For optimum security, double locking is recommended. Store keys in a secure place. Private health information, such as copies of medical records or billing records, must be shredded or incinerated if it is no longer in use or needs to be destroyed. Any paper with private health information on it, such as Post-it notes or scrap paper, should be shredded as well. Printers, copiers, and fax machines should be out of public view. If you are seeing several clients in one day, take only the care plan or assignment sheet of the client you are visiting into the home and leave the other records locked in your car out of sight. During your home visit, be careful not to leave private health information out where family members or others may see it. Any medical record should be kept in your line of sight during the visit. That means close to you so that you can see it at all times. Documents such as weekly assignment sheets or care plans containing private health information should be returned to your agency promptly for the client's records. When you give protected health information to a caller authorized to receive it, document it in your notes, giving the name of the caller, the date of the call, and a brief description of the request and information shared. Do not leave messages regarding private health information on an answering machine unless you have been given permission by the client or patient. When you are at the office, make sure that your computer is turned away from public view or has a privacy filter to protect client information. Password protection is essential to computer security. Never share your computer password with others. Memorize your password. Never keep a paper record. If you suspect that your password has been used by someone, notify your supervisor immediately. Make sure that you log out of programs when you are not using them. Log off the computer or lock the computer when you are away from your workstation. Only 10% of computer security is technical. 90% depends upon the actions of the person using the computer. In other words, you are the most important part of keeping electronic information secure. When using a laptop computer, keep it within your line of sight at all times or locked safely in the car out of sight. Some agencies require the computer to be cable locked to the car, in the trunk, or under the seat. Do not leave your computer or PDA containing protected health information locked or unattended in your car overnight, even in your garage. Keep it in your home in a safe location out of sight. If you are running an errand between visits that takes you to a public place, lock your computer in the car out of sight before heading out from your client's home. By planning ahead, you avoid others observing you as you safely secure your computer. The small size of personal digital assistants, or PDAs, which some people use to record notes or other protected health information, makes them easy to misplace. PDAs are also a popular target for thieves. The best way to secure your PDA is to carry it on your body in a belly pack or other container. If you are not wearing your PDA on your body, it must still be in your line of sight at all times. When not in use, lock the PDA in your car out of sight just as you would lock any item carrying protected health information. Follow your agency's policies regarding security codes, login, and passwords. Memorize your password and never share it with anyone else. When faxing, send only the minimum protected health information needed, and avoid sending sensitive health information, such as information on HIV or sexually transmitted diseases. Always verify the fax number before sending it. Do not include any protected health information on the fax cover sheet. Always use a fax cover sheet that includes a confidentiality statement. Take reasonable precautions to ensure that the intended recipient is either available to receive the fax as it arrives or has exclusive access to the fax machine. Retrieve documents from the fax machine promptly. If you see a coworker breaking HIPAA rules, report it to your supervisor or privacy officer in your
Hi.
agency.
Yeah, do you remember our kindergarten teacher? Yeah, she's my patient now. She's so sick.
HIPAA violations can result in disciplinary action or termination from employment. In addition to employee penalties, you can be subject to civil or criminal charges by the government. Fines or prison sentences can result from the following: knowingly releasing patient or client information to someone who is not authorized to receive it, gaining access to health information under false pretenses, releasing patient or client information with harmful intent, selling patient or client information. If you receive a complaint from the patient or client who feels that his or her privacy rights have been violated, contact your supervisor or the privacy officer at your agency. He or she will follow up on the complaint. As a care provider, you have access to information about your client's personal life and health. It is your responsibility to safeguard that information, keeping it confidential. Following HIPAA guidelines will protect your client's right to privacy and will also safeguard you and your agency.
I guess I would say the one thing that I would really want all care providers to know is if you're in doubt, don't say it. Because if you're questioning yourself, you probably shouldn't be sharing it.
Developing a warm human interaction with your clients or patients is one of the many rewards of providing care to others. It is a valued quality of being a good care provider, but it can also blur the boundaries between personal and professional. Remember, maintaining good professional boundaries makes it much easier to act in accordance with HIPAA guidelines.